Hello, hi. How are we today? It's nice to see you. Not so good. Yeah, I'm so sorry. We always meet under the craziest circumstances. Okay, I'm just gonna take a look at your chart here. Okay, and do you use the online portal? Yeah, okay. So I'm just gonna send details to your portal after. Yeah, if you don't mind, I'm just a mint. Would you like one? Okay. I just had lunch, and my sandwich had like a lot of onions, so I don't want to offend you with bad breath or anything. So, okay. So we're having a mysterious ailment today. Yeah. Okay. I can already sort of see what you're talking about. Oh boy. Okay. And this is the first time you've ever experienced this? Okay. How long have you had this? Okay. I understand. Do you know what may have caused this? Is there any sort of, are we trying new products on our skin, our face? Are we, going swimming in lakes and things? You don't think so? You're not sure? That's fine. Well, it's fine. We don't really need to know what caused it. It just helps us figure out exactly what it is. But it's no problem. I'm gonna help you figure this out today. Okay. Tell me, does it hurt? Does it burn? Are we feeling any pain? Like, can you tell me, is it more like irritation? Okay. You don't mind if I get my hands in here to feel around? Okay. I'm definitely feeling some inflammation here. We can see it as well, but now when I touch these areas, are you feeling any pain? Okay. No, it's more of like a... Okay. So, any burning when you apply products? Have you been like moisturizer or sunscreen? Are you applying to anything like that? No? Okay. I can see it's looking very dry. Okay. A lot of excess dead skin. We might need to get rid of that first, so I can get a better look at what's going on here, if you don't mind. I want to get a close look first before we do anything, and then maybe I'll do like an exfoliator. Hold still for me, please. Okay. This area right here, I might need to use some tweezers or something to grab the skin there. Okay. Let's see. Interesting. So I see in your history you've had issues with acne in your life before. Okay. I don't see, like, other than acne, I'm not seeing any history of any other skin conditions. Has there been, like, anywhere else that you've gone with skin issues? Have you struggled with any skin conditions when you were younger? Okay. allergies that you're aware of? Okay. Are you taking any new medications right now? Nothing new? Okay, because sometimes we can have reactions that we don't expect to some medications that we're new to. Okay, so none of that. Okay. So not thinking it's an allergy, so there wasn't any new skin products. No. What about your pillow? Did you buy a new pillowcase or anything like that? Anything new that's touching your skin? Okay. A silk pillowcase? That shouldn't. No, if anything, that would help. Let's see. You haven't taken any vacations outside of the US? Have you gone down to Florida anytime soon or recently? No? Okay. Alright, well, let's continue. So I did want to just test sensitivity real quick before I do anything, because I don't want to start doing an exfoliator and find out that it's gonna cause any pain. So I'm just going to. Do you feel that? Okay. Did you feel that? Yes, but is it painful? Does it cause you any pain when I do this here? Okay. What about right there? Okay. What about right there? Okay. And right here. Alright, I'm gonna switch to this side here. I'm gonna do a sweeping motion. And you tell me, does it cause any burning or itching? Okay. Any burning or itching? Okay. What about right here? Alright. Right there. How are you feeling? And just one more. I just want to check right there. Okay. Good. Okay. And I think we can safely move on. Alright. So I'm just going to use a medical exfoliator just to get this extra dead skin off. Okay. Only a little bit. It should be very gentle on your face. Okay. Just go in here. How are you feeling? Okay. Just let me know any step of the way if you're having any issue. just gonna do these little circles, just to really get these areas right here. Circle, just to get these areas. Right here, okay, and right over here as well. These areas, okay. Good. Just going to get something to wipe excess off. Hold still, please. Good. Okay, just going to. I'm seeing that there's a stubborn piece that I need to use a tool here. Okay, just hold still for me. Okay. Okay, there is one more spot over here, okay? That just has a bigger piece that we need to remove. Okay, I should be able to look. Okay, good. Alright. That's taken care of. I would like to next add it's like a foam, but it's going to help calm what we have going on here. Okay, then I'm gonna do some measuring while that's calming down, and I believe I know what it is, but just a few more tests and then we will see. Okay. Just going to okay. Should melt right into your skin. Should melt. you should start to feel the cooling effect already. Okay. I'm already sort of seeing the inflammation start to subside. This should help with any discomfort that you're feeling. Okay, very good. All right, next we're going to measure the affected area. I'm just going to get close here, if you don't mind. So I'm just going to 3, 4. This part up here, just want to sit. That is about the affected area. This red is about right there, okay. And down here at the bottom, just this little bit is smaller, but these are the reddest areas right in the center. Okay, and this one right this and this part okay. Alright, just going to write this down real quick. Record this. Was 5, 6. Okay. And this was. Okay, good. Right now, can you tell me do you feel as though it has affected your vision at all? Do you feel like, are your eyes feeling itchy, or are you experiencing any redness in your eyes? Anything out of the ordinary? You aren't sure? Okay, because I'm asking, because I'm seeing a little bit of redness. I know that a lot of your face is affected, and because everything is so connected, things can spread. Okay. So I'm just going to have you follow my instructions for a moment, okay? Can you tell me how many fingers I'm holding up? Okay. 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 Okay, good. Can you look at my nose, please? Okay, and tell me how many fingers I'm holding up while keeping your eyes on my nose. Okay, good. And over here. And over here. Good. And up here. And about here. Good. And down here. Okay. Alright. Just want to make sure it didn't harm your peripheral vision, okay? Can you keep looking at me and let me know when my fingers leave your field of vision? Okay, good. Keep looking at me. Okay, good. And let me know when they enter your field of vision. Good. And let me know when they enter your field of vision. Okay, fantastic. I think that your eyes are fine, but I do want to add some special eye drops just in case. If you don't mind, it's just going to help your eyes And if they're not affected, it can do nothing but help, okay? So can you look up, please? Okay. Good. And in this one here, very good. And can you blink, 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 please? Blink, 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 blink. There we go. Blink, 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 blink. Fantastic. Once again, just want to make sure that it hasn't spread to any other areas. Alright, so let's see here. I want to take a look at your ears. Okay. Take a look in your ears if you don't mind. Okay, we're just going to take a look at your ears here. Take a look. Good. Okay, I'm just going to take a look in your ears on this side here. Take a look. And once more on this side, I'm going to take a look. Okay. And take a look. So I'm not seeing any serious issues with your ears. Could use a cleaning, but other than that, I don't see any redness or inflammation of any kind. I will, although, give you a little clean, just the outer parts. Okay. Just going to start on this side. Okay. Okay, just going to clean out your ears here. Just make sure that got everything there. Just good. Get around this part. Right, let's get the other side. Okay, that's good. That's good. Make sure that get this outer part. These can always collect dirt and collect dirt. Sounds good. This part I can make too. Should be good. Just a little last little. Make sure that I do a thorough job. Make sure good. Thorough job. And over here. Okay. Good, okay. Alright. Now, let's take another look. Now that we don't have as much dead skin in our way, and I can finally see what we have going on here. Have you had any issues with pus or mucus or anything like that? Okay, anything is starting to sort of make sense here. Just a few more questions. Have you had any recent illnesses recently? Have you been sick? Like with the common cold or anything like that? Okay. Right. Understandable. And you haven't been in contact with anybody who has had a similar rash sort of thing on their face? Okay. Have you been outside at all? Okay. Any gardening or anything like that? Okay. Right. Okay. Well, I'm pretty sure I know what it is. Okay, rashes like these can happen during the winter months when dry skin becomes a bit more chronic. But I think that you might just have some sensitive skin as well. Just because of your history with acne, it seems like your skin is quick to become inflamed, which can be a thing. So I'm going to send you home with a type of antibiotic. It's similar to an antibiotic. It's going to work from the inside out, and soon enough your face, the redness should subside, the inflammation should go down, and it will go back to normal. I'm just going to type up the prescription here if you don't mind. Do you have any other questions for me regarding your skin rash or treatment? Okay. Great. So I can show you what it looks like actually. So I'm gonna send you home with some of these. And this will be a 30-day dose. Take one in the morning and one at night. Okay. You shouldn't have any issues with side effects, but of course if you find yourself with anything, please do call us. And if it is severe or anything like that, please do go to the emergency room. But as I mentioned, these shouldn't be giving you any side effects. It's just going to heal you, again, from the inside out. And it'll really help you out. Okay, so now that you've seen that, do you feel a little bit better about the treatment plan? I know it is a very long period of taking the medication, but it seems like your case is a little advanced. I know it can be difficult to come in when in the beginning because it may seem just like dry skin, but no judgment. Most people don't care to do anything until it gets worse or until they find that they can't fix it themselves. It's no issue. No, it shouldn't cause any lasting damage or scarring or anything like that. Your skin should fix itself with no issue. Okay, so I went ahead and sent that prescription to your pharmacy, and I would like to see you in 30 days just to make sure that everything has worked and the medication did its thing and that you're no longer experiencing these issues. So yeah, I will see you in 30 days. You can go ahead and make that appointment with the lovely nurse at the front desk. Okay. I know it is late, so